Act number 6975 entitled Department of the Interior and Local Government, DILG, Act of 1990 operationalized and entitled the call for a tangible reform in the country, public safety services, particularly for the uniform bureaus under DILG. Coverage of supervision by the Jail Bureau. Number 1, city jails. Number 2, municipal jails. 3, district jails. Classification of jails based on inmate population. Class A jails with 100 or more inmates. Class B jails with 21 to 99 inmates. Class C jails with 1 to 20 inmates. Republic Act number 9263, an act providing for the professional of the Bureau of the Protection, BFP, and the Bureau of Jail Management and Penology, BJMP, certain provisions of Republic Act number 6975, providing funds thereof and thereof or purposes, organizations in key position of the Bureau of Jail Management and Penology. The BJMP shall be respectively headed by a chief who shall be assisted by 2 deputy chiefs. Number 1 for administration, number 2 for operations. Purpose of confinement. A. To segregate him from society. B. To rehabilitate him so that upon his return to society, he shall be responsible and law-abiding citizen. Bureau of Correction Admission Procedure. Safekeeping refers to the custodial mandate of the Bureau's present correction system, and shall refer to act and ensures the public, including families of inmates and their victims, that national inmates are provided with their basic needs. Reformation, which is the rehabilitation component of the Bureau present correction system, shall refer the acts when ensure the public, including families of inmates and their victims, that released national inmates are no longer harmful to the community, becoming reformed individuals prepared to live a normal and productive life upon reintegration to the mainstream society. Manning level of the Bureau. A. Custodial personnel to inmate ratio 1:7. Reformation personnel to inmate ratio 1.24. Operations of the Bureau of Corrections. Directorate for the Reception and Diagnostic, former RDC. Upon arriving at the Reception and Diagnostic Center, inmates will be presented on the written notification of the inmate grievance procedure. The Reception and Diagnostic Center primary function is to orient, evaluate, and classify each resident before being assigned to a juvenile correctional center or alternative placement. B. Security and Operations Directorate provides leadership and coordination in the planning, development, implementation, and operation of university-wide integrated security system to include alarms, access control systems, video surveillance, technical platforms, and physical hardware. Reformation Directorates administer Reformation Program. Directorate for External Relation, formerly External Relation Divisions, or ERD, shall be responsible for pre-release and post-release programs of inmates due for release. Directorate for Reception of Diagnostic. The DRD shall likewise be responsible for the conduct of classification of each and every inmate admitted to the Bureau. Quarantine cell or unit, a unit of the prison or section of the RDC where the prisoner is given through physical examination including blood tests, x-rays, vaccinations, and immunity. Inmate shall be placed in quarantine for at least 5 days. An inmate shall remain at the RDC for a period not exceeding 55 days, where he shall undergo psychiatric, psychological, sociological, vocational, education, religious, and other examinations. Staff members of the DRD or the RDC and their functions. The psychiatrist responsible for the examination of the prisoner mental and emotional makeup. Number 2. The psychologist responsible to conduct study on the character and behavior of the prisoners. Number 3. The sociologist study the social case situation of the individual prisoner. Number 4. The educational counselor conducts orientations classes in order to change inmates' attitude towards education and recommends educational programs for the prisoners. Number 5. The vocational counselor to test the prisoner's special abilities, interests, and skills and recommends for the vocational course best suit to the prisoner. Number 6. The chaplain encourage the prisoner to participate in religious activities. Number 7. The medical officer conduct physical examination and recommends medical treatment of prisoner. Number 8. Custodial correctional officer recommends the transfer and type of the custody of the inmates. Admission procedure in prison. Number 1. Receiving. 2. Checking of commented papers. 3. Establishing the prisoner. 4. Searching the prisoner. 5. Briefing and orientation. Admission. After registration, the inmate shall be photographed front and side view, fingerprint, and assigned a permanent prison number. The male inmate shall be given regulation haircut and his bird mustache, if any, shall be shaven. Issuance of uniform, etc. The newly admitted inmate shall be issued 2 regulation uniforms and suit and 2 t-shirts. He shall be issued the following items: 1 blanket, 1 mat, 1 pillow, 1 mosquito net, 1 set miskit, 1 repair slippers. The inmate shall be held responsible and accountable for the items issued to him. Personal effect of the inmate. In addition to the articles supplied by the prison, the inmate may bring clothes and other items essential to his well-being provided. The quantity, nature, and dimension thereof will not interfere with the safety of the living conditions of the other inmates. The superintendent may allow the inmate to bring in electrical equipment like television sets, radio cassettes, video players, electric fans, and similar items provided the same is common use with the other inmates. In no case shall an inmate be allowed to bring in luxurious items such as air conditioners, carpets, sofas, beds, sleeping mattresses, washing machines, and the like. Wearing of jewelry. An inmate may not wear any jewelry items, shall however be allowed an expensive watch. Treatment programs. The 2 approaches in threatening criminal offenders. Number 1. Institutional-based treatment or reformation programs. A. Educational and training program. B. Work and livelihood program. C. Moral and spiritual program. D. Health and welfare program. E. Sports and recreation program. F. Behavior modification program to include therapeutic, community, or counseling and casework. The reformation program shall be undertaken by professional reformation personnel consisting of corrections technical officers. Correction technical officers. These personnel employed in the implementation of the reformation programs. Who are correctional technical officer? Correction technical officer include priest, evangelist, pastor, teacher, instructors, professors, vocational placement officers. librarians, guidance, counselors, physicians, nurses, medical technologists, pharmacists, dentists, therapists, psychologists, psychomatician, psychiatrist, sociologist.